Today we're going to continue our discussion on colic. Last time we talked about colic in horses, and this time I want to talk about management of colic in horses. First, what are the signs of colic? How do we know a horse is colicking, and when is it time to call the vet? There are many signs of colic. Some horses are stoic and show little signs, and some are overly dramatic. Tennessee walking horses, for example, are rather stoic with colic. So if you notice the signs I'm going to talk about, call the vet immediately. It's bad. I've had a few where the very observant owners notice the first signs, and by the time I get there, the horse has fallen over dead because they've been colicking for so long but didn't show any signs. Thoroughbreds, on the other hand, well, they're overly dramatic and tend to think the sky is falling for the slightest amount of pain. So, signs. The classic signs are horses that are looking at their belly or kicking at their belly. They might paw their feet, and they may roll. They could also be sweating profusely, they could go off their feed, or just be acting sad and lethargic. If they are in a lot of pain, they might grind their teeth. And colic affects the GI tract, so a lot of owners will call saying they haven't noticed their horse defecate. Let's start with what I tell all my horse owners to do before a colic happens. First thing is first, have Banamine on hand. If I can get to a colic right away, I don't want you to give this Banamine. But we all know with the shortage of large animal vets that sometimes it takes some time to get a veterinary evaluation. If it's going to be a long time and there are no options for sooner evaluation, I have people give a dose of Banamine. So to do that, you need an active VCPR so you can have the prescription drug on hand. What I have noticed is if you have the Banamine on hand, you won't need it. If you don't have it, you will need it. So keep a VCPR with your vet, see them once a year for annual work, and to get a tube of Banamine paste to have on hand. Now before I go any further, if you aren't my client, you shouldn't listen to me for a standard protocol. You should ask your vet for their colic protocols. This is what I want my clients to do. Ideally, I don't want you to have to give the Banamine, but let's say you notice colic signs. The first thing you do is start walking your horse. Walking is great for a horse with colic. Walking stimulates the gut to move in the aboral, or away from the mouth direction, which is the normal direction and what we want the gut to do. I've heard people say each step of my exam may not be worth it for various reasons. For example, if this is a surgical colic, the walking isn't going to do a thing. Why do it? Because we don't know what type of colic it is yet. What I want to do is cover all my bases. And think about yourself. Have you ever been gassy and uncomfortable, and then as soon as you start walking, you let one rip? It's doing the same thing in you as in a horse. And if this is a gas colic, perhaps walking will fix everything. Then I want you to call your vet and let them know what's going on. As long as you can chew bubble gum and walk at the same time, you should be able to walk your horse and get on your cell phone. If you can't do this, then have a buddy walk your horse. I would rather talk to you, the owner, on the phone than your friend. Often friends, although well-meaning, may not relay exactly what you are wanting. And this phone call is the first step of a business deal. Yeah, we're booked up today. This is an emergency, so it'll cost extra, but we're happy to get you seen. Your friend says come on out, but didn't know you just emptied your bank account on fixing your truck that just broke down. Friends are more willing to give away your money than their own. So you're on the phone and your vet may ask you to assess some things, and then the two of you and your vet will come up with a plan. Let's say the vet is on his way out. Well, the next thing I want you to do is hook up the trailer. Wait, the vet is on the way. Well, there are two types of colic, medical and surgical. Surgical requires transport to a surgical facility. Same thing as having that Banamine. If you have the Banamine, you won't need it. If your trailer is hooked up, you won't need it. I'm not superstitious, but go ahead and try not hooking the trailer up and see what happens. So the trailer is now ready to go, or you have made a phone call asking for a friend with a trailer to be ready to help you if needed, since you discovered your trailer had a flat tire. One way or the other, transport is now ready. Okay, the vet arrives. And this is what I did for years and years. And then I did something controversial that really got my clients upset with me. I started requiring people with trailers to haul their horses into the clinic. As discussed in previous episodes, the clinic change episodes and trailers episodes, if you'd like to take a listen for more information, when I built a clinic, I needed people to come to me. First, to pay for the clinic, but more importantly, to the client so I could see multiple sick animals at once. People needed in faster than I could get to them all by driving to them. And with colic, this made complete sense to me. Remember we talked that walking may stimulate the GI motility? Stimulating that GI motility moves gas around and gets the gut moving. Well, in a trailer, if a horse has gas colic, all that bouncing might move a gas bubble and start fixing the situation. And guess what? About 80% of colics are gas or spasmodic colic. The trailer can help with that. Walking can help with that. The next biggest type of colic is impaction colic, which I feel we have good luck managing as well. The last 6% of colic is the types that may need surgery or more intensive help. Now those are the ones that might need referral, and hence a trailer. If you're already hooked up and at my clinic, you're that much closer to a referral hospital, and time is sometimes very important. Now I have managed some of those cases at the clinic or farm, but I in general like those numbers that only 6% of cases may need referral to a big specialty hospital. But still, you need a relationship with your local vet so you can have those 94% of cases treated and managed at the farm and at the local clinic versus making a big trip to a specialty clinic. But again, this is why I have Horse's Trailer. The rough roads you come in on may help fix 80% of colic cases. Or maybe one of those weird cases like splenic entrapment, which would fall as part of those 6% of cases. The trip could help with that one as well. Trailer rides are stressful for horses and could cause the spleen to shrink, which would resolve the splenic entrapment. At the very least, like I mentioned before, you have your trailer hooked up, and if you needed a surgical colic to be managed, you are ready to go to a surgical facility, which for my clients is a straight shot down the road from my clinic. So hauling to the clinic seemed perfect to me. It helped me see multiple animals and was better medicine and was resulting in quicker times for both me seeing the animals and for getting them to a referral hospital if necessary. I even had a few colics resolved by the time they reached me, and all I had to do was my exam and make sure everything was okay. But for some reason, I received a lot of pushback from this. A number of clients were upset and just drove to the referral hospital. That always confused me, because that's way more expensive when it might not be. I understood that in those 6% of cases, it did save some precious time by just going to the referral hospital. But if we can manage 96% of cases at the local clinic, I feel like that is fairly effective and a good reason to go to your local vet first. It's also like you're fine with the quality of services when I came out to the farm, and now I think they're better. So you thought I could fix it before, so why not let me fix it now? It seemed these clients were just mad I was the one telling them to hook up the trailer. But a good amount of people refused to haul their horses in, and they wouldn't use me. And I guess I'm not sure if they found other vets to come out or not, but I remember explaining my reasoning, as I did a moment ago, and multiple people flat out refused to trailer their horses to the clinic. I would even ask, "You have a functional truck?" "Yes." "And you have a functional trailer?" "Yes." "Okay, I'm not seeing the problem. Haul the horse in." And truthfully, I have still not quite figured that one out. Now, before you think I'm a monster, I will go out to colics if the owners have no mode of transportation. I typically first offer horse haulers, which I have a list of people who will do that, but often clients can't get in touch with the horse haulers fast enough, so I end up having to go out to them. Is using a horse hauler as fast and inexpensive as if you could haul into the clinic? No, it's definitely more expensive, and it's not as quick. Now, whether it's at the clinic or at the farm, here are my steps of treating colic. Every vet is not going to do it my way, and that's okay. They have developed their own ways, and you should trust your veterinarian because you have a relationship with them and know to trust them or respect the degree of training they hold, even if it doesn't meet your expectations of what should occur. I remember once I got cussed out up and down because I didn't meet the expectations of the client. I treated the horse and it got all better. But I didn't complete the exam how the owner had seen before, and she was very emotionally upset and screamed obscenities at me. I considered this unacceptable. While her horse was writhing on the ground, I told her if she screamed at me one more time, I would pack up and leave. She was quiet for the rest of the process, and while it was an uncomfortable time for the horse and vet, the horse did fine. I know the horse did fine because the client wrote me a letter telling me the horse was fine, but that I was a horrible vet and didn't know what I was doing. I appreciated the update, though I wasn't sure how I was a horrible vet if I fixed her horse. Anyway, so here's my process. For vet students, in the script I have doses of drugs that I am talking about. For the episode, that's not the most important part, but join the Patreon if you want those doses. The first and most important part of a colicking horse is the exam. The point of a vet doing an exam is twofold. The first part is you have to use the exam to figure out how to fix the problem. And the second part is parts of the exam could fix the problem. That's what our job is, to figure out what's going on so the owner can make informed decisions about their horses. Now, sometimes figuring out what is going on means referral, and sometimes we just can't realistically figure out what's going on. But the exam is how we start figuring out what's going on and start treating the problem. So, I have a question. Let's see how many of you know the answer to this. What is the most important piece of a colic exam? If you can only get one part of your exam complete, what part of the exam do you want to do? Anyone? Heart rate? No. Gut sounds? No. I love asking my vet students this. It's the mucous membrane color and perfusion time. You can tell so much from this information. Gum color gives you an idea of the state of the blood, and from that, the state of the gut. This also gives you an idea of the state of the heart, and that to me is the most important part of the exam. It's actually the second thing I get, though. First, I look at the horse from afar as I approach. What's the horse doing? Is it pawing, looking at its flank, sweating? Does it have injuries from rolling and thrashing? Is it standing stoically? Do I see feces nearby? Does it have an arena full of sand? What's the quality of the fields it stays in? I'm trying to put the entire picture together. Then I get to the horse. I lift the lips up and assess mucous membrane color and quickly get a perfusion time. What I want is a pale pink color and perfusion less than 2 seconds. If I find something else, I know we're going to have problems. Next, I move back to the left side of the horse and do a skin tint to assess hydration, and then move to the heart. I get its rate and listen for murmurs. To me, the rate is very important. This is what helps me determine if this is a medical or a surgical colic. Medical colics don't hurt as much, so the heart rate is not as high. If the heart rate is consistently over 70 to 80 beats per minute, I'm starting to wonder if this case should be referred to a surgical facility. Anything 50 to 70 isn't that bad. It's medical and I can likely manage it. Anything below 50 I consider normal. Next, I move back and quickly listen to the lungs and make sure they sound right. Respiration rate is important, and when you are a younger vet, I recommend counting respirations while you listen to the gut. But I will admit I tend to only count respirations if they seem increased drastically. Often I've already listened to the lungs and count the respirations when I'm listening for gut sounds in the 2 left quadrants. You may have to listen for a full minute per quadrant. This is why I sometimes count the respirations then. It saves some time on the exam. If I don't hear gut sounds, I have to give time for those guts to move through their normal peristalsis. After I listen to the gut on the left, I will typically get digital pulses from all four feet from that side of the horse, and then move back to the temperature. Typically, while my thermometer is working, I start letting the client know some of my exam findings. It is important to get the temperature now because different colics can be distinguished by the temperature of the horse, and if you take the temperature after you rectal the horse, you will have an abnormally low reading. So after the temperature, I listen to the gut sounds on the right side of the horse. Remember, potentially for a full minute for each quadrant. Then I listen to the lungs and the heart. There's my physical exam, but that's not the colic exam. After I make a plan with the owner, my next step is to give the horse sedation and buscopan and draw blood. I may not send the blood out if the horse is better the next day, but I want to have it on hand in case the horse isn't better, because then I'm going to send the blood out. Or if it's early in the day, I usually try to send blood out earlier. Then, after the sedation and the buscopan, I twitch the horse and pass a nasogastric tube. It is critical that this tube goes in the right spot. This is why I always pass standing on the left side of the horse, and while passing, press the horse's nose towards its body. That allows the tube to go into the esophagus versus the trachea. This also allows me to see and feel the tube in the esophagus. You can't see it in the trachea. Once passed, this tube is allowing me to assess the esophagus and stomach, sometimes the small intestines. If I get fluid or reflux, I drain this fluid as needed. Remember, the smell that comes out or the reflux is drained gives you a lot of information. For example, a sweet smell may indicate the horse got into a bunch of grain. If there is no reflux, then I'm going to pass a solution of mineral oil, water, and Epsom salts through the nasogastric tube into the stomach. This, to me, is the best way to hydrate a horse, a bolus of water in the GI tract. The Epsom salts pulls water into the GI tract, which may help lubricate firm items. The mineral oil should coat and pass in the next 12 to 24 hours and gives a slick appearance to the feces, potentially lubricating them and helping them pass out as well. There is debate about how effective the mineral oil is in the equine community, but I still feel it is a valuable part of the colic workup. Now, this is why I wanted the nasogastric tube in the correct spot, because none of that stuff that I just mentioned should go into the lungs. When I'm done, I kink the tube and pull it out in one swift motion. If I had reflux at the beginning, I may leave the tube in. Next, with the horse still twitched or at my clinic twitched and in the stocks, I will complete a rectal to evaluate the rear end of the horse. Often, this is where I tell my clients that this is only giving me an idea of what is going on in 60% of the horse's GI tract. There are still parts I'm missing. So even as vets with our colic exam, there is still 40% of the tract where we just don't know what is going on with it. And there are things we can miss there. Now, to get an idea of the rest of the tract, I still have a few tricks up my sleeve. Literally. I typically take my rectal exam glove and take some of the feces from the GI tract and fill the sleeve and feces with water. I will hang this on my stocks and watch while I complete the rest of my exam. If sand is in the feces, it will settle out and be noticeable. In Kentucky, sand isn't as big an issue as it is in the southern states, but I still keep an eye out for it because sometimes people have sandy arenas that horses are in and potentially need a sand colic treated. Also, if I'm at the clinic, I have started rolling my ultrasound out and ultrasounded the horse at this point. This gives me a little more look at certain areas of the intestines, and sometimes I can see other things going on in the body. But just remember, this exam, the colic exam, is more thorough than just guessing for what type of colic might be going on. But we still can't evaluate the entire tract of horses with our exam. There is always the potential something could be missed, and if the horse doesn't respond as we expect, we're going to recommend surgery. This isn't to run up your bill, but our exams can only rule so much out, and sometimes that is the step that we need to push people to potentially fix the colics. I can rule out certain problems as I do my exam, which means the odds are increasingly more in your favor if I don't recommend surgery or come up with a diagnosis that requires surgery. But if I don't find anything, surgery may be the only way to evaluate the whole tract and find the root problem. Lastly, if none of the parts of my exam push me to make another decision and things are getting better, I give a dose of Banamine IV. Please note, if you have injectable Banamine, never give it in the muscle. This could become a rant. I'm not going to let it, because you know Banamine in the muscle can cause extreme reactions. No, I said I wouldn't go there. Okay, deep breath. I'm not going to go on my Banamine rant. I'll give some Banamine IV. I then have the owners walk the horse while I write my notes and make up the bill. I come back and take the vitals of the horse. If things are going well, I send them home with instructions to let the horse drink, but no food until tomorrow. Typically, I tend to see horses at 3 to 6 p.m. for colic, so I tell them to go home and walk the horse for 30 minutes to stimulate GI motility. Give the horse a break for 30 minutes, then repeat the process until midnight. Then go get a rest yourself and check on the horse every 2 to 3 hours until morning. Most horses may be slightly uncomfortable, but mostly just start looking tired. If they don't look worse than when you brought it into me, we're probably doing okay. I send them home with Banamine paste to give if things get worse, and if they're getting better, I still typically give Banamine for the next 2 to 3 days. No grain for a week, and instead start back on grass for a few days and slowly work to their regular diet. Now, at any point during the exam, I believe this to be a surgical case, I may place an IV catheter. And since you already have the trailer hooked up, I send you on to a referral center in Lexington. Sometimes this is where we have the conversation that the expense of a surgery in Lexington, or because of the inability to transport to Lexington, is not practical, we start talking about euthanasia. There's a lot of different ways to treat if we find specific things on the exam, but that's my basic exam and treatment for colic cases. If you're calling me again in the night and need to see me a second time for the same case, I generally refer you on down to a referral hospital, because if another dose of Banamine doesn't fix the problem, it's probably elevated to beyond medically managed, or at least needs more intense medical management than often can be provided at the farm. Hopefully, in the morning, my staff gives you a call, waking you up from a long night, and you say, yes, everything's settled down during the night, and our horse is doing well. If not, or if I do have any concerns, I recommend sending the blood out, and we decide how to go from there. Colic can be real bad. It's scary. That's why I recommend having a relationship with your vet so you know their protocols for handling colic. That's why I recommend having a functional truck and trailer so you can transport your horses, which is both a fix and sometimes necessity for survival of them. Not all cases of colic will be able to be resolved. And I have to say, surgery is not inexpensive. But if you plan ahead for these emergencies, you will have better chances of your horse getting through and you being slightly less stressed when it happens. I'm Dr. Nathan. Thanks for listening. I hope our discussions are valuable to you and aid in giving perspective. If you want to contact us, please reach out to theveterinarypodcast@gmail.com. You can find a complete list of the podcast episodes on SoundCloud. If you find this information helpful and want more content, please join our Patreon, patreon.com/theveterinarypodcast. And don't forget to follow our Facebook page, facebook.com/theveterinarypodcast. As always, thanks for listening, and I hope this information is helpful to you. If you
do find it helpful, please like it, share it, so other people may find it helpful as well.